good afternoon, everyone. I'm Abby Danhos from the New England QIN-QIO, and I will be moderating today's webinar. So thank you all for joining us for today's Home Health Collaborative webinar, and this is going to be on patient engagement. Before we get started, I'm going to quickly go over a few housekeeping items. This call is going to be recorded for training purposes, and I'll provide you with details on accessing the webinar recording at the end of the presentation. Your phone lines are currently on mute for the duration of Kathy's presentation, and we will take questions at the end, and I'll give you instructions on how to unmute your line. So at this time, I'll introduce today's webinar speaker, Kathy Roby. Kathy is the Connecticut Home Health Lead for the New England QIN-QIO. Kathy is a registered nurse with over 40 years of experience in home health care. She specializes in quality management, improving home health provider quality outcomes, and reducing acute care, hospitalizations for Connecticut home care providers. So please welcome Kathy Roby.
Thank you, Abby. Of course, given the fact that here in Connecticut anyway, it's pouring buckets, and on a damp, rainy day, I'm feeling every one of those 40 years, and that really makes me feel quite old. I want to wish everyone a happy Veterans Day, especially those of you who either have served or know someone who has. Even though it's a very damp and drizzly day, we do want to remember to honor those. And I was out visiting a client this morning, and I was really amazed at the number of flags I saw everywhere on telephone poles and buildings, and it's really wonderful to see. So today, our topic for discussion is patient engagement. And I'm asking you to consider the question, are we truly connecting with our patients? Or when our nursing and therapy and home health aid staff are visiting them, are they talking at them? Or are the patients really feeling a bond, feeling understood, feeling that they can, in fact, take back the control over their lives? So today, as we go through, what we're going to talk about is being brought to you by the New England Quality Innovation Network. That's what the QIN stands for in the New England QIN-QIO. This is our partnership between health-centric advisors, who works directly with providers in Massachusetts, Maine, and Rhode Island, and Celadine, working with the providers in Connecticut, New Hampshire, and Vermont. We have our website, healthcarefornewengland.org. Today's presentation, as Abby will explain to you, is going to be taped, and it will be available for you to review and to use with your staff after today's presentation. And in today's presentation, I will also be referencing an earlier webinar that you will be able to find on the website. There are tremendous materials available to you on the website. This is what it looks like. www.healthcarefornewengland.org. When you arrive on the landing page where the red circle is, you want to click on For Providers. You'll see in the drop-down, Home Health has risen to second from the top, and you'll want to click on that particular link. That's going to take you to previous webinars that we have done, and although this slide is a little older, you will actually see all the webinars that we have offered since February. One of the ones that we are going to be referencing today is about engaging your staff as well as engaging patients. And you will want to go back and reference that one as you go forward using the materials from today. There is a home health lead in every single state. Massachusetts is using a team approach due to the number of providers in their state. And on this slide, you will find the email contact information for everyone in each state, so that if you have questions, if there is something that we can do to help your agency directly with this project, please feel free. Email us directly. If you don't get an immediate response, if you get some kind of a bounce back, please email me or call me, and I am happy to work with you and connect you with the lead in your state. So today's topic, as I said, is patient engagement. And the question we're asking is, are we really connecting with our patients on a personal level? And who is driving our care planning process? Not what, not a philosophy, not some ideas, but who is driving our care planning process? If you think back to when you were in nursing school, when you became a therapist, whether it's PT, OT, speech, or social work, think back to being in school. Can't you hear that instructor saying to you, here's your assignment for the weekend. It was always on a Friday afternoon. Here's your patient scenario. I need you to create a care plan, identify the patient problems, make a problem list, and create a care plan. And, of course, we were all such dutiful students. We went out, we did that, and when we were done on Monday morning, we returned a beautifully crafted care plan. We identified the patient problems. We identified the actions and the tasks and the learning that the patient was going to do. We did. So I ask you again, if that is the process that your care providers, your clinicians are following, who's driving the care planning process, and who is it that is truly vested in its success? Today, our goal is to identify the four basic concepts that underlie patient engagement and patient self-management. We're going to define motivational interviewing, which is the process or method that enables your clinical staff, from clinical supervisors right down to home health aides and homemakers, to actually connect on a personal one-to-one basis with the clients they care for. We're going to identify the four steps in the motivational interviewing process. We're going to develop a process to engage the patient in driving the care plan so that the patient is the one who owns this process. I currently have an agency client that I'm working with that has actually been using patient engagement, patient self-management, using motivational interviewing and SMART goals in their care of their patients for the last 4 years. And during that time, they have driven their acute care hospitalization rate down to just 14 even. That's an amazing progress. They've literally cut it in half. And you can do that too. Using these concepts, using this process, and using a basic PDSA plan, you can reduce your readmissions and improve your patient care outcomes at a time when improving your outcomes and your patient's experience of care is critical. So what is patient engagement? And why should we really be concerned about it? As I just said, this is a critical time for us. Improving outcomes and improving the patient experience of care will improve your star rating. And we're all worrying a little bit about what our January star rating is going to look like. If we utilize a motivational interviewing, SMART goals, and pursue a patient engagement model, you are going to accomplish improved patient care outcomes and an improved patient experience of care. So why should we be worried about this? Patient engagement is the process that places the individual, and that's how we should be referring to them, not as the patient, because that implies the diabetic in 42-bed A, but the individual person who happens to also have diabetes. And by placing them in charge of managing their illness and allowing them to make informed decisions, they will engage in positive health behaviors. An engaged individual is a person who becomes motivated, who becomes actively involved, takes control of their illness, and they will have better outcomes and a far better quality of life. So what is the foundation of patient engagement? As I said, it does have 4 basic steps. The first is that we have to let go of the control. We have to give it back to them. We have to allow them to self-manage and acknowledge that they may make some mistakes along the way, but if they feel that they're in control, they will move to the second foundation step, and they will become more and more motivated to be the one in charge. And once they understand that they can manage themselves, they are motivated to want to do so, those 2 will add up to an activated patient who reaches out and says, no, I'm going to do that. I'm going to do my blood sugar every day. I'm going to tell you what it is. I'm going to weigh myself every day. And I am going to call the doctor if I gain 2 pounds because I'm the one who will be able to say to him, yep, last night I ordered Chinese because my grandchildren were here. And I know that I shouldn't have, but it was a special occasion. That is being an activated patient. Action planning allows the patient to then create their own SMART goals so that they can achieve that self-management of their chronic illness, create a plan that they are comfortable with that achieves the goals that they have identified and set for themselves. Self-management is defined in all the literature as the ability of the individual to manage symptoms, treatments, make lifestyle changes, and accept the consequences of their own health condition. That's textbook speak. What does it really mean to your 80-year-old cardiac patient who is also diabetic and lives in a senior housing? If they can achieve individual motivation, it will mean that they feel a sense of competence. I am capable of checking my blood sugar, and I have the resources to do it. I have a glucometer, and I know how to use it. Autonomy. This is my responsibility. It's my body, and I want to feel better, so I will do this task. Ownership. I care about this. I care about the outcome. If I check my blood sugar, I control the blood sugar, I'm going to feel well enough to go to my granddaughter's recital on Friday night. Activation, the patient's desire to actually perform the task, is fed by their desire to be independent of us. Being chronically ill creates a sense of dependency. And one of 2 things is likely to happen. Depending upon the individual person's personality, the 2 things that can happen, one of them is they can foster that dependency. Oh, I'm so ill, I'm so tired, I can't eat out in a restaurant, I can't do this, I can't do that. You'll have to do it for me. And they utilize that as a way of tying family members and keeping them close by. Alternatively, chronic illness can create a situation where the individual becomes activated. They can fight back. I want to do something. I want to be independent. I am my own person, and I am not going to be dependent on somebody else to do my blood sugar, somebody else to take me to the store, somebody else taking me or allowing me to do the things I want to do. But in order to get there, instead of the dependent, clinging person, we need to find out what this person wants to do that is important to them. That's the trigger point that we need to identify in motivation so that it can become the driver for the next steps that we need to take. So we need to find out what they want. And that's where motivational interviewing comes into play, because this type of a conversation will enable us to help the patient, the person, to to verbalize exactly what it is they want, that they want to do, that they want to have, and we will then be able to say to them, together we can accomplish that. If we do this, you'll be able to do that. And that is part of creating the plan. Making an action plan has to center around taking responsibility for a specific task, activity, or outcome that enables your client, your patient, to demonstrate their ownership of what's going on. If they've identified the goal, they've identified the why, I want to do X because that gives them control. It gives them autonomy. It is theirs. So then we make an action plan with them that enables them to accomplish that. So here's an example. The patient who spent 5 days in the hospital with a severe exacerbation of their congestive failure. When they come home, research tells us that in 48 hours or less in the hospital, an individual is going to lose a significant amount of their physical endurance, their ability to move around, their ability to walk, their balance. All of that is lost in 48 hours. If your patient has been hospitalized for 2 days or more, they are significantly debilitated and weakened. Today is Wednesday. On Friday night, their grandchild is having a little dance recital at 6 o'clock, and they desperately want to be there. And so what are we going to do? In the course of conversation, we get them to verbalize. This is what they want to do. We get them to verbalize why it's important to them. In return, we identify for them what they might need to do. You need to be able to walk from your chair to your daughter's car. So how can we get you there? Well, let's make a plan. The plan might be that for the rest of today, every time there's a commercial line, you're going to get up, walk to the door, and come back. And by tomorrow, you'll be able to walk to the door and out the door to the front door of your building. And so on. By making an action plan, but giving it to them to implement. They're the ones making the plan because they can see quite literally the cause and effect of how that's going to work for them. And that is how you're going to enable them to move through the process. So let's talk about the first step in the process. Let's talk a little bit about motivational interviewing so that we can have the conversation and figure out what it is that the individual person wants to do. Individual motivation, the motivational interviewing techniques, have also been named the OARS methodology of having a conversation. The first step is expressing empathy. One does this with open-ended questions. You want to stay as far away from possible from yes and no answers. You don't want to say, I'm sure you're happy to be home. That's a simple yes or no. Asking the person instead to tell you about their recent hospitalization. Tell me a little bit about how you came to be in the hospital. What happened the day before you went in? What happened the day you felt ill and you called 911? That's not a yes or no question. We will need to find out what they understand about their illness and how it's affecting their lives. What did the doctor tell you was the reason that you went in the hospital? Doctor said I had heart failure. What does that mean to you? What did he say to you was actually happening? These are the kinds of questions that are not answered with a yes or no, but will give the person the ability to share their story because they do want to share it. It's a traumatic event, and they want to share it to reduce the impact it's had on their emotional status. Develop the discrepancy. What does that mean? What that actually refers to is acknowledging the difference between where they are and where they want to be. What is it that you would really like to do? Now that you're home again, tell me a little bit about where you would like to be physically. What is it you'd like to be able to do by Friday, by next week on Friday? Not much further out than that, just something visual and reachable. And then acknowledge the difference between where they want to be and where they are today. So if you acknowledge that, then you're able to talk to them about what it is they're going to do to get there. And as you see in box 2, it says, what did you like to do before you got sick? What have you tried to do before that worked for you? What didn't work? I wonder what you think it might take so that you could do that again. When the person says to you, I want to get my own mail out of the mailbox. Okay, that's a bit of a walk for you today, isn't it? Can't get there, can't even catch my breath by the time I get to the door of my apartment. Okay, I wonder what it might do to take. What would it take so that you could actually walk that far? I don't like those exercises. They're very boring. And I don't have time. Okay, that brings us to the R. You want to roll with their resistance. You don't want to argue. You simply want to listen to the why that they're not saying. Why is that a problem? And you're going to go from there to talking about how you can help them to fit in the things they might need to do in order to accomplish the goals that they are verbalizing. So you're going to support that goal. If the goal is, I want to walk out to the mailbox and get my mail. If the goal is, I want to be able to get to my granddaughter's recital a week from Friday. I want to go to my daughter's for the Thanksgiving holiday. We have a golden opportunity with Thanksgiving and Christmas coming. When you're dealing with diet compliance, a golden opportunity in these holidays to say, how about if you and I together could figure out a way that you could go to your daughters for the Thanksgiving holiday and we could figure out how to put together a plate for you that would not be something special, that wouldn't make you feel funny in front of all the relatives, but you'd be able to be part of the event. That's really what they want. It's not to be picked out, not to be identified separately, not to have it be a big deal, but just to get some control back over their own life. And so that's what we're doing. We identify how hard it is, we roll with that, and then we support the goal that they select and help them to figure out how they're going to do that. All of which sounds really good, doesn't it? However, if we're going to do that, we first need to engage our staff so that they are going to be willing to use this model. To engage our patients, we have to first engage them and get them onto this page. How can we do that? If we go back to our roots in quality management, we can create and implement a PDSA plan that will enable you as the quality manager, as the point person, to actively engage your staff so that they can, in turn, actively engage the patients. So what's our plan? That's step 1. If you think back, if you were on previous calls, you would know that on June 10th, Rita Grimes, my partner in mischief here at Colladine, did an excellent program on engage the provider, engage the person. The link is here, and if you download the actual slides, you can click on this link and it will take you directly to the Home Health Collaborative Session 5 on how to engage your staff so that they can go out in the field and practice patient engagement and motivational interviewing skills. You can, having reviewed this, having redone this particular webinar with your staff, you can then schedule small groups and act out motivational interviewing skills. Give them patient scenarios. Help them to work. You'll find that your nurses have excellent ability to draw upon their experience with some of their most difficult patients, to be the patient, and to have someone else try to draw from them a real goal, a real desire for something, and put together a plan that might work. As you're training your staff, as the person driving this, you want to go back and identify a population that you want to work with. So if you're going to focus on improving the outcomes for your congestive failure patients, you're going to need to look at the data, the baseline data for their outcomes and for your process measures for this particular group of patients. So using the motivational interviewing techniques, you're going to have the staff now go out and help their patients in that designated population to go about identifying at least one patient-motivated, patient-driven goal. They're going to be able then to implement a first step tool with that patient. What's an example of a first step tool? If you have patients in that population who have had recent hospitalizations, perhaps a crisis event that they managed at home, you're going to have them do a self-assessment. Obviously, one of their goals should be, I don't want to go back in the hospital. The holidays are coming. I don't like the food. I want to be with my family, and I want to be well enough to be part of the holiday celebrations. That gives you the opening to implement that first step tool, the self-assessment of their risk of being readmitted. Based on what's in there, they can then work with the nurse. They can become a team to develop an action plan with SMART goals. There is a tool on the HHQI website. Both of these tools are there. The self-assessment of readmission risk and the My Action Plan that will allow the patient to create a SMART goal. You remember what a SMART goal is? It has to be specific, has to be measurable, has to be appropriate for that person, has to be reasonable so that they could achieve it, and it needs to be time specific. Somebody seems to have unmuted their line. If you could mute it up again, please, that would be wonderful. So once we've started doing that, you want to look at your results. This is the study step in plan, do, study, and match. When I say that you want to rerun your data, we are looking at running your CASPER data and whatever OASIS data you can take from your scrubber if you're using one. I do want to remind you, however, that having change become evident in CASPER data is going to take a minimum of 6 months for it to show up. You will get more immediate data response in your scrubber data if you have one. But you want to run both. You want to look at your process outcome data for your patients for the designated population. The way to get that is through running tally reports, which allows you to get process outcome data for a specific diagnosis group. It allows you to get your readmissions data and your emergent care data for a specific diagnostic group. And then you're able, 4 to 6 months from now, to compare that to the data that you've run today or that you may have run 3 months ago. 11. You're going to want to keep reviewing earlier training that you've done with your staff. You want to go back to Rita's June 10th, engage the provider, engage the patient. We also have available for you a program we did on exactly how to get in and run tally reports and specific focused OASIS reports. You want to encourage your staff at each monthly staff meeting to share anecdotal challenges and patient successes You want to make sure that they are doing that with one another because that helps to motivate and engage them. You want to ask yourself the question, is my hospitalization rate beginning to trend downward? And are my patient populations demonstrating any specific self-management skills in what diagnostic groupings? Because this is going to help you to refine your focus and continue the work. What about your actions? You made a plan. You implemented it. You studied the results. Now what? The best thing you can do is to create and post large, colorful graphs of your acute care hospitalization rates, regardless of which direction it's trending in. If it trends up, then you want to be doing an analysis of why. Is it a specific patient population that you need to turn your attention to? Is it happening on the weekend? Is it happening on Wednesday night because all the docs are off on Wednesday? You need to be able to identify those factors. And the reports that are available to you on the HHQI website will give you tremendous insight into what is happening with your acute care hospitalizations. You want to continue to review and role play the motivational interviewing skills. You want to continue to refine your staff's ability to set the SMART goals, but also to know and understand very thoroughly the clinical and educational pieces of preparing them to work with congestive failure patients, diabetic patients, COPD patients. If you've selected the CHF population, then you want to be planning first the patient engagement, motivational interviewing, and SMART goals in service. The next one would be on the medications relevant to the CHF population. Perhaps the next one after that is on heart smart diets and proper exercise, energy conservation exercise programs. So you want to plan your education around the particular chronic illness that you're focusing on first. Once you've done that, you are able to establish your next target goal and restart your cycle over again. So in the past, we've talked about how the Million Hearts Initiative relates to each of the subjects we've addressed each month. So how does Million Hearts relate to patient engagement? Patients, people, relate to the term heart healthy. They don't relate to low salt, low fat. That sounds like deprivation. When you're talking to a diabetic patient, a person with diabetes, you're not talking about a calorie-restricted, a carb-restricted diet. We want to talk about a healthy diet that focuses on proper balance between proteins, vegetables, and fruits. We want to focus on linking quote-unquote exercise to a patient-defined that will clearly require some physical activity for people to achieve it. We want to link...
Excuse me, just 1 minute. One of the lines became unmuted. Will you please make sure to mute your line? We're hearing some background noises. Thank you.
You want to try to link wellness-type behaviors to their targeted goal of staying out of the hospital, because clearly that is what they want to do. So at this point in time, I want to take a moment and ask you to think about what you're doing in your own agency. Have you started, since Rita did her program in June, have you started trying to teach your staff how to work with motivational interviewing skills? Are you thinking about how you're going to engage your patients? Before we open the lines to talk about that, I want to also close the loop a bit on the 5-star program. The 5-star ratings, the first ratings came out over the summer, and now the HCAP component will be live in January. It is definitely, clearly proven and demonstrated that if your patients have a positive experience of their care, their perception of the quality of your care is going to be much higher and will give you more positive outcomes in your HCAPS reports. If your patients become if the people you are caring for, if they become more actively engaged in taking control of their own lives and their own health, they will have better outcomes. They will, with motivational interviewing and being actively engaged, their perception of their experience of care will be more positive. So what you have is a completed circle. Improving patient engagement improves patient motivation, improves their outcomes, improves their perception and their actual experience of care. And all of those together is going to give your agency an improved process outcome report on OASIS and improved outcomes in the experience of care in your HCAPS, regardless of what program you're using to gather the data. As Abby said at the beginning, I've been in home health now for, God help me, 40 years and counting. The reality is, when I first came into home health, as agencies, as providers, as clinicians, we worked together. We helped one another. If one of us had a terrific idea, we shared, and everybody's outcomes improved. I know that it's a highly competitive environment. I know that everybody's goal is to try and get the lion's share of the referrals and to have the best outcomes in town. If we work together, if we share ideas, if we mentor one another, we will all succeed. And yes, you will still get your fair share of the referrals, but your patient star ratings, your outcomes, your patient experience of care will in fact continue to improve. So I'm asking you to take a moment, think about what happened at your last staff meeting. Think about your last patient satisfaction survey results. Think about your last CASPER report, your last patient experience of care. What worked for you? Do you have a process improvement in place? What are you doing with your nurses? What can you share today with everyone else on the line? And I'm delighted to tell you that today's webinar had the highest enrollment that we've had in the last 3 months. This is a hot topic. I know you're all interested. If you have questions to ask one another, Abby's going to tell you how to unmute your lines, and I'm hoping that someone will break the ice by sharing a little bit about what they're doing in their own agency.
All right, thank you, Kathy. This is Abby again. At this time, we'll take a few questions and other discussion items. If you would like to ask a question, please press #6 on your phone to unmute your line.
I'm hoping we'll have somebody who's willing to start. I'm looking at the list of who signed on here. I recognize a lot of names. I really don't want to call on anybody that's so mean. But does anybody have a question they'd like to ask today? No, I'm not hearing any takers, huh? Okay. Well, hopefully next month, right? That would be a good thing. I want to remind everyone that every third Thursday, the Home Health Quality Improvement website is offering an educational webinar. There is one next week, and there will be one in December on the 17th. So that 1 week from today, which I believe is November 18th, there will be an HHQI webinar. You should be receiving your email to get yourself registered, so please register for the webinar. And then in December, you will receive another one. On the HHQI website, they have archived all their previous programs, and you are able to access these at any time. They also have opened up the HHQI University, and at least 50% of these programs offer CEUs if you happen to be in a state that requires CEUs for your nurses or your therapists or social workers. These are all free, and you are able to access these at any time. They're an excellent way to pre-plan for nursing education, for staff education. You're able to have your staff access them by providing the link. They can do it at any time. It doesn't have to be a scheduled day and time in your office, although that will allow for them to have the ability to have conversation and to practice some of the things that are on these great webinars. So that's the end of today's program. I'm leaving the floor and the lines open for Q&A. I'm going to stay for a couple more minutes. I hope that this has been a helpful program. As we have said in the past, the people on the slide who are your contact people for each state, we are delighted to come on site. We're delighted to work with you one-on-one or even in small groups. If there are agencies that are reasonably close to each other, if you want to get together, have us do a planning session, an education session, we would be delighted to do that at any time. So please give us a call, send us an email, go to the QIN-QIO website, look at our past webinars, and we will go from there. Our next scheduled webinar is going to be, we hope, on partnering with one another and peer mentoring, one agency to another, nurse to nurse, supervisor to supervisor, clinician to clinician, and that will be on Wednesday, January 13th. I look forward to talking to you. Please feel free to give us a call at any time. Take care, stay dry, and have a great day. Abby?
Yes, thank you, Kathy, and thank you, everyone. I just have a few final announcements before we end today's webinar. When you close out of this webinar, the evaluation will automatically pop up on your computer. If you could please fill that out, we would greatly appreciate it. And if you don't have time to fill that out now, or you're currently sharing a computer with someone else, you will receive an email tomorrow morning with the link to the evaluation, as well as the link to the event page on our website. So be on the lookout for emails about our next webinar. As Kathy mentioned, it's in January. We are taking December off for the holidays. So thank you again for attending, and have a great day.
Take care, everyone. Bye now.